Welcome, everyone, to the Unlock Efficiency Uplevel Your Workflows webinar. Thank you for joining us today. We look forward to your questions throughout the presentation. You can enter them by clicking on the Q&A icon on the right of your screen. My name is Linda Park, and it is my pleasure to be with you today to introduce Fernell Walker. Fernell is the Vice President of Optometric Relations at Eyefinity. He's responsible for developing, sustaining, and elevating relationships with all members of an eye care practice, from staff to optometrists and ophthalmologists. In his role, Fernell frequently visits practices and connects with the industry through conferences and education courses. This outreach helps bridge the needs for providers with Eyefinity's technology to ensure continuous improvements in our software. As a nationally acclaimed speaker and the author of the textbook Pure Optics, Fernell's passion for eye care is widely recognized. He also stands out having earned a master's in ophthalmic optics, a credential held by a select few, and an MBA. Beyond his professional pursuits, Fernell enjoys astronomy and is a trumpet player in the Big River Big Band in Portland, Oregon. Welcome, Fernell.
Hey, I'm so excited, so glad to be here, Linda. Great. Thank you for that great introduction. And we're here to talk about how we can unlock efficiency, up-level your workflows with Eyefinity and Compass. Many of you signed up for this, and some of you may have heard the buzzwords that people are talking about it. I just returned from a conference this past weekend where people were really excited about what Eyefinity and Compass offers. So let's start off with something pretty straightforward, which is, what is Eyefinity and Compass? Well, I'm glad you asked. Eyefinity and Compass is our latest cloud-based, all-in-one integrated platform, and it's built on 4 functionalities. Those functionalities include the practice management side of your practice, which is where all the transactions takes place. That's where the opticians work. That's where we check our patients in, part of that patient journey. That's where we perform inventory. That's where we manage reports and all the financial data of a modern optometric practice. The second part, or the second core functionality of the 4, is the clinic side. This is where all the exam records are kept. This is also where we interact with our patients when they get an eye exam, and all the equipment interfaces and all that fun stuff over there, once the patient goes back to see their doctor. And then we also have patient engagement, which I'm really excited about. And that's the ability to maintain the relationship with all of your patients and ensure that they have all the information that they need. And we're going to talk about that today as well. And then lastly, the core functionality of analytics. You need the ability to understand the performance of your practice to make sure that that practice is not only just surviving in today's world, but really thriving. And what does the outlooks look like? And what does that look like beyond just simple reports? So Eyefinity and Compass is based upon these 4 functionalities that everyone absolutely loves. Now, today, we don't have time to go through every single functionality and feature, because that would take hours and hours. So I'm just going to show you and highlight some of the things that I think you're going to really love with Eyefinity and in Compass. So let's go ahead and get started. So why choose Eyefinity and Compass? Well, like I said before, it is a cloud-based platform. What that means is it's going to be very secure. It is going to be easy to use from any device and anywhere you have internet connectivity. A lot of the tasks that you perform every single day for yourself and your staff, believe it or not, for both the optician and the optometrist and all those scribes and ophthalmic technicians, a lot of that can be automated, right? It's the same stuff we do every day, but there's ways in Eyefinity and Compass to really automate those things to save time and really up-level what you're doing. It's going to improve efficiencies when you automate a lot of these tasks, because those efficiencies are gained because we can let the technology, Eyefinity and Compass, do the work for you. And one of the other things I really love is on the clinic side, right? For the traditionally we think of this as the health record side. There's a lot of face-to-face now interaction, because you're not limited to just using a keyboard, right? You can actually use an iPad right? A templated device that is a native technology where I can have that face-to-face communication with my patient, where they are going to appreciate that, because we will just improve that interaction with the patient, rather than them seeing the back of your head as you're typing in information into the software. Lastly, really Encompass facilitates technology integrated practice, or I like to think of it, I call it TIP, a technology integrated practice. Patients live in a technology world. They're on their iPhones, their iPads, their Droid devices. Their homes are automated, with AI, artificial intelligence. So I'm excited to say, so is Eyefinity Encompass. Now we have a lot of that technology that they're used to having, and a uh, digital assistants from their assistant to help them. Well, now all of that is an Eyefinity Encompass, right? So let's talk about the cloud, because I mentioned that before. Really, the thing that I love about the cloud is the cost savings is huge. No more relying on a server. No more relying on paying for backups, because that backup is already done right within the Amazon Web Services cloud that we use. Automatic updates, backups, no longer do you have to call a technician, pay for that, shut down the practice. All that happens in the background in the evening when your practice is closed. What about cyber security protection? We've got you covered. It's Eyefinity Encompass, which means that we are the only ones in optometry that has SOC 2 certification, which is the highest certification that you can get. Only Eyefinity offers you that, no other software platform, as well as built-in e-prescribing right inside the system there. I don't have to log on to a different system. So that really up levels my efficiency as well as consolidated costs, including one simple monthly payment, right? That I don't have to think about beyond that. You can automate all of that. So you eliminate, just in summary, we eliminate cost of a server, separate IT support and a hassle with that, and making sure that they're available, third-party cloud hosting if you're using like a remote server or cloud server and so forth. Just not the same experience and workflow, right? And you're going to notice that secure, HIPAA compliant. No one runs around saying, hey, HIPAA's hip, right? It's so fun. Well, guess what? We're HIPAA compliant. We automate all of that in forms within Eyefinity Encompass. Patients can sign even right on the iPad with their finger. So I eliminate printing out paper, having them sign stuff, and the expense of that, the time of that it can be really disruptive to the workflow and much more. And as I mentioned before, the SOC 2 Type 2 certification, which is always evaluated in real time to ensure that your data remains secure, the same type of security that the military uses, and also our banking industry, and much more. So let's jump into the part you may be thinking of. Now, if you're the optician out there, you're thinking about how to up level the game and how to make your life easier. And I'm going to show you some of these in just a few moments. So, but just to show you my short list of things that I'm excited about as a master optician with 34 years in this in optics and eye care, is VSP bulk patient eligibility authorizations. Wow, what do you mean by that, Fernell? Well, I'm glad you asked. What I mean by that is, how many times have you thought about, I've got to log on to Eyefinity, right? And I've got to log in patient by patient, put in their information, date of birth, put in the first name, last name. If there's a misspelling and so forth, I've got to be mindful of all those things. Well, guess what? Eyefinity Encompass simplifies that, because I can get authorization for as many patients as I'd like based upon the appointment scheduler, right? So if I could just, if they're on my schedule for that day, I can get it instantly within a matter of seconds, and I'll show you that. Electronic remittance advice, also known as ERA. So that's after the fact, if you're a biller and you're getting that VSP check-in, and you want to be able to reconcile that in real time and know upfront even what that patient paid and so forth. Now, all of that guesswork is taken out of the equation, because this is a game changer. Now we can collect more upfront, and when the check does come in, we can just click a couple of options there, and it'll reconcile the check for me. And so something that normally before would take hours, yes, hours with an H, can now happen in a matter of just a few minutes. So that's going to save a tremendous amount of time in your day so you can get to other things. Also, one of the things as a master optician I'm excited about is the frames catalog with images. How many times have you ordered something, it's the wrong frame or the wrong color or the wrong size? Well, with Infinity, with Infinity and Compass, I have the ability to not only search for the frame, see it in real time, and everything's preloaded for me. I just have to select what I want to use, right? It's all through frames catalog data or frames data. I can see the frame. I can confirm the color. I can show it to my patient. Is this the frame? Here's the frame. Here's what the color looks like. Although we don't have it in stock, here it comes. Streamline eyeglass contact lens orders, automated tasks to make my life easier, as well as that patient engagement, as I mentioned before. Have you ever had two patients in the same system and there's a duplicate? Guess what? Only in Infinity and Compass, I can merge those patients, not lose any data without having to somehow delete, invalidate, so forth, and figure out, am I on the right patient, and so forth, as a lot of other software programs. Well, that's a non-issue in Infinity and Compass. So I'm excited about that. Online scheduling. Wow, I have the option to have my patients perform online scheduling. So what that means is if I have a patient and they're searching to see that doctor or come into the practice, when do they do that? Maybe it's outside of office hours. Okay, let me retract that. It's usually outside of office hours, right? So now I have the ability to allow the patient to have online scheduling and much more. We can send even notifications. Your glasses are ready, so much more. So the patients have the ability to navigate through Patient Navigator their experience that they want to have with your practice, making it much easier for them to be a patient of yours. And it also facilitates that technology integrated practice or that digital experience, as I mentioned before. Now you'll notice that these are kind of my highlights, but if I showed you the extensive list, it'd be over 100 game changers easily, well over 100. Let's take a look at those game changers for the doctor as well, shall we? Native iPad app, which means that I have the ability to have the latest technology, the latest tablet available on the market at my fingertips from home, or patient refills. And let's say I'm out of the office and I can just pull that information up, or I can actually take that around with me, walking around, and not have to worry about a big clunky keyboard with PC in my office. Now, if I like to use a PC keyboard, can I use that? The answer is yes. Can I use both? Yes. A lot of practices use both, right? And so the staff can also use either or as well. So that's the exciting technology. We even have AI predictive selections per doctor. What does that mean? You might be thinking to yourself. That means artificial intelligence built into Infinity and Compass. Infinity and Compass, based upon diagnosis, based upon user, based upon patient, can actually pre-select before you even select it, saying, would you like to have your assessment plan based upon this diagnosis? Would you like to have this served up? And then you just have to say, this is what I want to select, especially when we get to medications. That's my favorite. Auto procedure codes. I no longer have to choose, what is the procedure code? Searching through nearly 100,000 ICD-10s and so forth, and the procedures, all of that is simplified as a part of my workflow, including modifiers. That's right. No longer do I have to guess. Is it an RT? Is it an LT? Is it a E1, E2, E3, E4? It's all done for me. Also, unlimited auto letters, built-in consents with signature, ability to import patient medications, built-in e-prescribing. You don't have to log out anywhere. And guess what? It's included with Infinity and Compass. So that's going to save me time, money, and improve accuracy. Lastly, one of my favorite game changers is image management. What that means is that image right now at your practice doesn't actually live in the patient's chart. What do you mean it doesn't live in the chart? That's right. That image sometimes is basically trapped on the device. So let's say I have an Optimat, or let's say I have Topcon Maestro, or OCT, GDX HRT, or whatever you're using, right? It's trapped many times on that device. With Infinity and Compass, it lives in the database within the patient's chart. So number one, ensures accuracy. I'm looking at the correct image. Number two, I can make comparisons. I can even notate and annotate right in the patient's chart anything I want to see on that image in real time. If I have multi-location, I don't have to log into the other location. I can see it real time within seconds of being in the patient's chart. So that's really exciting. So, wow, I can't wait to take a look at all of this with the list that I shared. So let me jump right in and let's take a look at Eyefinity and Compass. Can I get a first drum roll here? So I'm going to go ahead and switch over to Eyefinity in Compass. Really exciting. So as you can see right here, we are in Eyefinity and Compass. You'll see that my navigation is simplified with my ability to search for patients, appointment calendar, confirmations, order management, productivity inventory, reports, and much more, claims management and administration, which is all my setup right over there. Simple, easy to use, quick response, shows you who's logged in. I still have my quick list over here. So if I want to see all my patients for the day, I can quickly see that from anywhere. So that's exciting. I can quickly look at it, see it if I want to confirm who it is, or even search for patients there, which right now you can't search any other program with a quick list with that. You can only see what's static. So I'm excited about that. Let's go ahead and take a look at the ability to do VSP authorizations in bulk. Watch how easy this is. I simply go up to patients. I can come down here. There's that merge feature as well. I mentioned before, if I want to merge multiple patients or two patients together, VSP authorizations. I simply select VSP authorizations, and it initially thinks I want to see patients for the next day, but maybe I want to do it the morning of. Hey, today's Wednesday, June 25th. I can come through here and I can see these authorizations. Now, what you're going to notice is if I select all, that means all patients, all items. I can say, or maybe I say, I just want to get authorizations for the exams or the frames. So you get to be in control. You can select what you want. How many times has a patient told you, hey, I just want to come in for my exam. I'm going to do frames and lenses later, or vice versa, right? Or maybe I want to get it all, show those authorizations, what they're eligible for, what they're not eligible for, or I want to split, see the split here, authorization. Once I get the authorization, such as I have here with Hunter Pence, you can see I have the authorization numbers right here. It shows me what this patient's already been pre-authorized for. I can submit that. All of that becomes a part of the record. So I don't have to print anything out. I don't have to fax anything. I don't have to log out to eyefinity.com VSP to see that. That's going to save your staff a tremendous amount of time. I'm excited by that, right? So all of that, you ask, how does it know? How does it actually know? Believe it or not, it's actually based upon my scheduler. Look at that. There's my schedule for today, and I have my patients there when I'm open, when I'm not open, and much more, okay? Let's talk about the frames catalog. I mentioned before how we will load everything through frames data for you, which is great. So that frames data subscription you have and so forth, you don't have to do any loading and so forth. It's going to come preloaded for you. What that also means is during my setup in admin, when you first switch over to Encompass, you can turn vendors on and off so you only see what you want to see, or you can see it all. So let's say I'm working with a patient and I want to see, right, if this specific Calvin Klein 431 frame comes in certain colors. Maybe the patient wants more of a brown, maybe tan color and so forth. So I can look through here. It's going to perform a search. As you can see here, it's looking through thousands and thousands, right? So it just performed a search, 971 options in that collection. I can say, you know what? It does come in that warmer tan color. And Mrs. Jones, look at the frame. I can actually see it. No one else does it like Eyefinity and Compass. The ability to see the item number, UPC, the gender. I can see who's the manufacturer. As you can see here, Marchand. I can see, is it discontinued, not discontinued? Is it active? I can tell the patient, sorry, this has been discontinued. Let's just search what's active. I can then go through there and say what's on hand, which means what do I have in inventory? I can search by size. So maybe I want to say I want to look for a specific size, right? I can do that. Am I looking for extra small, medium, and so forth? So something is not in my frame gallery, right? The dispensary, I can easily get to that as well. So that's exciting. And opticians everywhere, I know are going to love that. I know I love it. which is great. Shows me how many were on hand, and much more, which is great. All right, so let's go ahead and clear that option there. The next thing I want to share with you is, if I wanted to, I could have done the same thing through order management to see what's there and much more. Let me show you what the patients area looks like as well quickly. Watch how fast I can jump to patients. Bam, right there. Here's my patient. Right? I can see if there's a photo with the patient, get to their demographics. I can see their material orders. If it's an eyeglass order, look how fast this is. It's insurance, non-insurance order. I can create a complete eyeglass pair, lenses only, frame only, extras, right? Any add-ons and so forth. Any RXs on file, I can add those if I don't have them there. Let's say I'm looking for a frame only. Here's another place I could do that right there from the screen, and it's really snappy. Much, much snappier than you would if you were using like a virtual server, if you will. Now what I want to do is show you a couple other things. Let's jump to claims management before we look at the doctor side. Look how snappy that is. It's great. I can look at claims search. I can quickly, easily search through claims. I can see if there's any failed claims over here. It gives me an alert instantly. Your current software doesn't do that. You've got to look at certain places. I have full control all from the same screen over here. I can get to billing claims, generating my EDI transmissions if I want to send it everything electronically, batch patient statements. Love it, love it. Billing reports, right? And then process payments. Here's what I was talking about before. ERA, electronic remittance payment. So if I wanted to process that ERA and I wanted to show what was in review, what's been posted, what's been not posted, and so forth, I'm going to take a look at what's been posted over here. So I have my Mutual Omaha Insurance, Medicare Part B. I can take these checks in very easily, and I can create test files if I want to. And if you're a biller, you know exactly what that means. And I can see how many claims are in here, payments that were made, what was applied, what was unapplied, all in one place. I can do that automatically. I can even have the software do all of that for me. Yes. All right. Wow. Now the next thing I want to do is I want to share my iPad with you. Let's go ahead and take a look. I'm going to show you the doctor's side. So bear with me in just one moment. I'm going to share my screen. So now what you're looking at is Eyefinity Encompass on the iPad. Now, once again, could I have done this through the PC as well? Yes. Or a Mac? Yes. Right? I could have done that, but I prefer to use the iPad because it's much faster. I can see all of my patients for today. Mrs. Champagne Walker, Hunter Penn, so same patient over there. I had her at 8 o'clock. I had this patient, I had him at 8:20, right? Create visit, copy forward, and much more. I'm going to quickly go through just a few elements of the exam, right? So whether you're an optometrist, ophthalmologist, as you just saw there, the software is just, Eyefinity Company is going to work great for you. So now, what am I looking for here? Wow, this looks so different. Yes, the reason it looks different is we've simplified the screen. So your workflow is CCHPI review of systems, vision exam, ocular exam, impression plan. I'm just going to show you the speed and the power of Eyefinity Encompass, and I'll go slow so you can at least see it. I'm going to document my patient's CCHPI. Patient comes in. What are you here for? This is part of the AI, artificial intelligence. It shows me my top 10 complaints over the past history. As I use Eyefinity Encompass, it's going to basically stack rank these for me. So whatever I use the most will be listed near the top. If something's not listed, let's say something that is not on my list, foreign body sensation is on the list, or right eye, left eye, and so forth can be there. Patient came in for blurred vision, right eye, left eye. Tell me about the complaints. Blurred vision. What's the quality? All distances. Severity is moderate. Duration. How long has this been going on? 5 or more years. Done with that. Then I'm going to jump over to review of systems. Mark everything that I go over reviewed. Go over that with the patient. Done with that. You'll see everything shows in green. Your current system doesn't even go half that fast, right? Now, what's great about that, you want to see what it looks like, the narration. Let me show you. Look at everything I just documented. Look how beautiful that is, right? Chief complaint, blurred vision, HPI, 47-year-old female, gives me all the information right there, okay? So let's just jump back into the vision exam. If I wanted to, I can add glasses. I can import what she was wearing before very quickly, easily, including VAs. Save that, make any changes there for the habitual RX. Autorefractor, same thing, keratometry. IOP, predictive analytics, shows me what I use all the time. I use a tono pen, but we have every selection there, right? that you're going to need. Same thing with refractions. I can come into the refraction area, begin the manifest from the habitual RX, what she came in wearing, do my begin the manifest from right over there. Once it imports, I can come over here, which is better. 1, 2, 3, 4, make all the necessary changes, update her VAs 2020, save and done. Manifest just like that. Now I want to turn that into a final, done. Nobody is as fast as Eyefinity HR. What is the usage for this? Full-time wear, done, send. Now it's sitting at the opticianry table. So if I want to dilate the patient, I can easily do that. I can indicate patient's perla. So as you can see here, the speed, the functionality is unmatched with any other software on the market. Here, I'm going to go ahead and use tropicamide phenylephrine. How did it know that? Did I have to set that up? No. As I use Eyefinity and Compass, it documents that time date stamp right over there. Now let's take an overview of what I've done so far. And that was slow. Look at that. Green, green, pre-testing done. Lastly, slit lamp ophthalmoscopy. My patient came in, right? And it's going to basically present bilaterally. I have a bilateral view. Before, with your current system, you have to choose the right eye at the bottom, right? If you're using exam writer, then you got to choose the left eye. And what's my observation? Oh my goodness, I got to go back. I got to delete. I forgot to do that. None of that exists here. All of this, as you can see here, a lot of it is going to be AI driven for you over here, which I'm excited about that technology. We're getting ready to release even beyond what I'm showing here. So really some exciting things. Patient's a myope, we've already indicated that, right? We did a refraction, done. Follow-up, done, right? Counseled the patient, done. Let me show you a medical just for kicks and giggles. Let's say that my patient had primary opening angle glaucoma. Let's say their CDs weren't 0.3, but maybe 0.7, right? I look right eye, left eye, set my severities, already predictive analytics, it already knows. Follow-up for next visit, 3 months. I can set my protocol, perimetry, IOPs, corneal pachymetry, gonioscopy, done. When I go to write the prescription using AI technology, look at this. It already knows all those prescriptions there are related to what? Go ahead and say it. Glaucoma. That's right. So what if I didn't know what to give the patient? We also have the ability to show you and pull what every other doctor around the country shows and what drugs they would use. 36% latanoprost, timolol, right? We have Lumigan, Coumagan, Travatan, and so forth. I'm going to choose latanoprost. When I choose latanoprost, if this was the first time for the patient, she might ask me, hey, you guessed it, what's that going to cost, Dr. Fernell? Well, I see that you go to Albertsons, it's $13.66, but I've got a good RXE coupon that I'll go ahead and save you some money there. And you go ahead and send that over. And that prescription, once I press ERX, it's already there waiting for the patient, done. Just like that, I just e-prescribed it and now it's done. Now, let's pretend my patient also had a trichiasis. Boy, this patient's got all kinds of problems, right? I'm going to say right eye trichiasis, eyeglasses growing in incorrectly. I want to perform epilation today, right? I'm going to do that with forceps. It already selected it for me. I'm going to come over here and I'm going to basically use consents, right? And again, this is my workflow. Your workflow can be however you want. It's fully customizable, right? But what I want to show you here is after I explain everything to the patient, right? I want the patient to sign the form. The patient is going to sign her name right here. Right? Patient signs her name, happy patient, look at that. And I'm going to sign my name right there. That becomes a part of her permanent chart, which is great. Then we're going to put that bandage contact lens over there as well. Done with that after we do the trichiasis. What else is great? If this were a diabetic patient or a patient where I need to send an auto letter, your current system in Exam Writer, you're limited to one auto letter. There are many systems that don't even have an auto letter. But if I wanted to choose an auto letter over here, I can electronically send it to another physician, right? Let's say it's a primary, and then I can come over here and I can say, is that a diabetic letter for a patient, right? Auto generates for me, right? And it'll auto put that in there. And when I press send, I don't have to print it. I can just simply send it. So as you can see, it is very, very powerful. And here's all that billing there, right? Look at that, 92014, 67820, right? All of the codes, 92071, 92015, and I can even split this. And look, there's the modifiers that I promised right over there. I'm going to show you one last thing and we'll wrap up. If I come in here and if I perform images today and I want to look at those images, I can show the patient right on my iPad their OCTs. If I want to show them what's happened with their fundus photography, right? I could show that over time. If I want to make comparison to show what's happened in the past over time, I can write on it as you see there, right over there. I can show them what's happening with that optic disc right there. I can say, hey, there's drusen here, there's exudates, here's what that looks like, here's why I'm concerned, blah, blah, blah. You as their doctor, which is great, and much, much more. So as you can see, Eyefinity Encompass really is the most powerful electronic health records, practice management, all in one platform compared to any other software. Nobody does what Eyefinity Encompass can do. I wish we had about 8 hours, Linda, because there's so many things I can share with them. We haven't even begun to show the uplifting and scratching the surface of powerful Eyefinity Encompass. Linda, do we have any questions today?
Yes, we do. We have one. And just a reminder to everybody, if you have a question, you can enter it using the Q&A button on the right of your screen. The question we have is it possible to turn off or not utilize online scheduling if the doctor chooses?
Yes, that's a great question. I've heard this before. Absolutely. You don't have to turn that on because I know there are some concerns. Well, what if the patient no shows, right? The good news is you have full control. You can customize it. You can say, make it a request, not a request. There's so much that you can do. So you have full control of that. I also want to mention that on that side, which I love with the patient navigator, we have the ability for patients to see when their glasses are ready, right? To confirm their prescriptions, right? Whether they want to confirm it or not. So it's really a powerful solution all in one. So I don't have to have all these other solutions bolted on, so to speak, right? So great question with that. So absolutely yes.
Perfect, thank you. And it looks like that was the only question we had. But if you would like additional information about Eyefinity and Compass, please visit our website, www.eyefinity.com. You can also click on that QR code on your screen. And with that, I would like to thank you for now for your time and for the valuable information you shared with us today. And also thank you to everyone on the line for taking time out of your busy schedule to be with us. This concludes our presentation.
Have a great day. Thanks, everyone.